Good day, everyone. My name is Gidget Shayne Soliman, a first-year nursing college student that will perform a return demo about some vital signs, such as assessment of the temperature, pulse, respiration, and blood pressure of the patient. The purpose of this assessment is to monitor the critical information about the client's state of health. This is useful for monitoring and detecting medical problems. Now, the first thing you need to do is check if all equipments are functioning normally. And before doing any procedure, always introduce yourself and to verify your client's identity using agency protocols. Next is explain to the client what are you going to do, why is it necessary, and how can he/she participate. Discuss to the client that the results of this assessment will be used in planning of the further care or treatment. Lastly, perform hand washing before doing any procedure and to observe other infection prevention procedures. The first assessment is assessing the temperature. Apply gloves if performing a rectal temperature. Provide for your client's privacy because sometimes it may be too embarrassing for them. Position your client or patient to seam's lateral position if inserting a rectal thermometer. Place the thermometer. Lubricate a thermometer because it needs to be cleaned before you use it. Next is wait for the appropriate length of time because electronic and tympanic thermometers will indicate if the reading is complete through a light or a tone. Check the package instructions to wait for the length of time to wait prior to reading of chemical dots or tape thermometers. Next is remove the thermometer and read the temperature. If the temperature is obviously too high, too low, or inconsistent for the patient's condition, recheck it with a thermometer that is known for functioning properly. Clean the thermometer from the probe down to the tip and wash it if it is really necessary. And return it to the storage location. Document and record in the client's chart or on your worksheet. The next assessment is assessing the respiratory count. You don't need to tell the patient what are you really counting because they might change it. Now, the reason why I didn't tell when my patient is here earlier that I am counting his respiratory pattern is that when the patient is aware that the nurse is counting their respiratory rate is they will purposely alter or they will change the way their respiratory pattern. Now, you need to observe the depth, rhythm, and character of the respiration and document on or record on the client's chart or in your worksheet. The next assessment is assessing the pulse. Now, if you are using a DUS, a Doppler ultrasound stethoscope, you need to check if it is functioning normally. Select the pulse point. Normally, radial pulse, the first thing we are checking is the radial pulse. Normally, the radial pulse is taken unless it cannot be exposed or circulation to another body part is being assessed. Assess the client to a comfortable sitting position with the palm facing downward or sideward. In my case, I'm positioning my client's arm sideward. The client's arm can rest on the side of the body or across the chest. Palpate and count the pulse with the 3 fingers, the index finger, the middle finger, and the ring point, lightly on the pulse point. Assess the rhythm and the volume of the pulse. Document and record it on the client's chart or on your worksheet. The next is the apical pulse. Position the client in appropriate comfortable supine or sitting position. Expose the chest over the apex of the heart. Locate the apical pulse. Locate the fifth intercostal space for the adult and 4 for the children. Warm the diaphragm of the stethoscope before auscultating. Auscultate the heartbeat for 1 full minute. Assess rhythm and strength of the heart. Document or record it on your client's chart or on your worksheet. The last assessment is the assessing the blood pressure of the patient. Before doing the assessment, make sure to prepare 2 supplies, the sphygmomanometer and the stethoscope. Expose the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. Wrap the arm around the upper arm approximately midway on the arm, or 1 inch above the antecubital space. Insert the earpiece of the stethoscope on the ears. Make sure that it is clean. Place the diaphragm of the stethoscope over the brachial artery. There is a sign in the sphygmomanometer. Hold the bulb with the palm on the other hand and thumb screw between the thumb and the fingers. Pump the cuff and inflate until the needle rises 20 to 30 mmHg. Release the bulb of the air slowly. As the pressure escapes slowly, note the reading. Deflate the puff rapidly and completely. If in doubt, you can repeat the reading. Remove the cup from the arm. Prepare for storage. Clean the earpiece of the stethoscope and perform hand washing. Document or record on the client's chart or on your worksheet.